also like to acknowledge that this country was never ceded, it was stolen, and we look forward to the day when true reconciliation and acknowledgement is made of prior Aboriginal ownership and custodianship, and true recompense is made to Aboriginal culture and Aboriginal country. So welcome everybody, welcome to our forum. It is a great pleasure that we acknowledge the presence of everybody here, and especially the presence of Gabrielle deVietri, the Mayor of the City of Yarra. Gabrielle is just newly elected onto council and is a councillor in the Langridge ward, and before being elected to local government, Gabrielle worked in the arts, creating collaborative community projects for social change, as well as a paralegal at a refugee legal service, providing advice to refugees and people seeking asylum. She has a long history of community organising and has been involved in successful community mobilisation against the East-West Toll Road and organising events leading to human rights and climate change activism. And Gabrielle is one of 5 Greens councillors out of 9 that have been elected to Yarra Council since the last election, which was only 3 or 4 months ago. And we have 6 out of the 9 are brand new councillors. So Gabrielle, it's with great pleasure that we welcome you today. And Gabrielle is going to give us an overview of local initiatives. And as Mayor of Yarra, we are really rapt to have you here today, Gabrielle. So over to you.
Thank you so much, Peter, for that very warm welcome. And thank you, Bernadette, for inviting me to be here today. And thank you also for your acknowledgement of country, Peter. I'm also calling in from Wurundjeri land and acknowledge the Wurundjeri people as the traditional owners and true sovereigns of the land that we call Yarra, and pay respects to elders from all nations here today and to their elders past, present and future. Thank you so much for having me to speak here at what I believe is the first Yarra Drug and Health Forum for 2021. As many of you know, Yarra is a creative and very diverse municipality, and it also comes with its unique strengths and unique challenges. The council is aware of the significant impact that drug use has on the Yarra community, including both illicit drugs and legal drugs such as alcohol. I just wanted to check in before I launch into my speech, if this is the appropriate moment to do that speech, or if you wanted to have more of an introduction of other people here before going into that, Peter.
No, you go ahead, Gabrielle. I think that's going to be, the Zoom makes it for a more interesting process.
Okay, wonderful. Thank you. So you would be aware that there are precincts in Yarra that have historical long-term street-based drug markets, such as Victoria Street in Richmond. And we also have multiple world-class entertainment precincts. Collingwood, Fitzroy, Richmond all have their attractions in the entertainment business. And many of these businesses in these precincts are based around hospitality, and they hold liquor licences. People come from across Melbourne and even beyond to enjoy Yarra's nightlife. We recognise that alcohol and drug use are complex issues, and they can have negative impacts on mental health, on physical health, on social well-being and economic well-being for an individual, as well as for their family and social networks and the wider community. Yarra recently completed a health and wellbeing profile, and it identified that Yarra residents are more at risk of alcohol-related harm and injury compared to the Victorian average. And it also had higher rates of alcohol-related ambulance attendance, assaults and family violence. Illicit drugs follow a similar trend, with Yarra recording a higher number of reported drug offences and ambulance attendances compared with the rest of metropolitan Melbourne. So in order to address these challenges and improve wellbeing in our communities, we need to understand these complexities, the complexities behind these health issues and these behaviours. Yarra Council is aware of the stigma that people who use drugs often face and the accompanying impacts that this can have on their mental health, on their social relationships, and also on the resources that they can access. We strive to take a balanced approach that respects human rights and endeavours to make our community more inclusive and more compassionate. We have a commitment to the wellbeing of all individuals in Yarra, and we seek to foster opportunities for our community members to achieve the best possible outcomes while also protecting the safety and amenity of everyone. We recognise that drug use and dependence results from the complex interplay of psychological, biological and social factors which cannot simply be eradicated. We support a harm minimisation approach, which includes reducing demand, reducing supply and reducing harm to individuals and to the broader population by employing practical and proven public health measures that limit the negative consequences of drug use. And of course, I acknowledge that Council cannot and does not do any of this alone, and forums such as this offer a really important space for us to reflect on these issues and provide the opportunity to collaborate on how we address emerging issues. Since 1999, Yarra has advocated for a harm minimisation approach for illicit drug use and accepts that medically supervised injecting facilities are proven to save lives. They provide wraparound intervention opportunities to provide client health, public health, and offer a judgment-free space for people who use drugs. Yarra Council welcomes the Victorian Government's 3-year extension to the medically supervised injecting facility in Richmond and also the introduction of a second facility. And we eagerly await the outcome in relation to the second facility, which is expected to be located in the City of Melbourne. As I said before, we accept that medically supervised injecting facilities do help prevent deaths and they provide a genuine opportunity to connect drug users to essential health and social services, including being offered a path out of drug dependence. As well as advocacy, our main responsibility in this space remains the promotion of public amenity. In that space, we've doubled our resourcing for our dedicated footpath and road cleansing team, as well as a syringe management services in and around the North Richmond and Southern Abbotsford precinct. In 2019, Council successfully applied for the next round of the Public Safety Infrastructure Fund for improvements within the Victoria Street vicinity. And this project is expected to commence in 2021 and will focus on lighting interventions to improve perceptions of safety. There are also many initiatives being undertaken in Yarra by other stakeholders in the space, including the Victorian Government's $9 million commitment to improve local amenity around North Richmond and the North Richmond Community Capacity Building Initiative, which I believe our colleagues from the Department of Families, Fairness and Housing will speak about further later on in the forum today. We are also working closely with the Neighbourhood Justice Centre on their peacemaking project, which aims to ensure that the community is better engaged, better heard, better supported, and able to appropriately discuss issues relating to amenity and safety and lived experience. Since 2019, in October, we've also convened a working group to inform a consultation with vulnerable communities on the impacts of our local law that restricts public drinking. The local law is set to sunset in October 21, and council officers are working with the community and with service providers to make an informed decision on how best to proceed in the future. One of the other aspects that we'll be considering in this area is the recent commitment by the Victorian Government to abolish the offence of public drunkenness in favour of a health-based approach. It's a balancing act for us in Yarra to look out for health and wellbeing, while also addressing some of the antisocial behaviours and amenity concerns that can arise from alcohol consumption. And we're aware that no single intervention can address the breadth and complexity and dynamism of the issues arising from drug use, both legal and illicit. We will continue to work collaboratively with our partners in this space to make sure that we're aware of the needs of our community and to make sure that our response is necessary and appropriate. And this includes Victoria Police, CoHealth, the Department of Health, the Department of Families, Fairness and Housing, North Richmond Community Health and the Neighbourhood Justice Centre, as well as other service providers. I'm really, really pleased to have been invited and to be able to join the Yarra Drug and Health Forum today so that I can better understand these issues and more deeply understand these issues and understand them from a variety of perspectives from everyone who's here today, as well as connect with partners working to minimise harm arising from drug use in Yarra and work to find and implement solutions together. Thank you so much for your time today, and I look forward to participating in the rest of this forum.
Really appreciate your input today, Gabrielle. Before we move on to our next speaker, I just want to say, how have you found being Mayor?
It has been an incredibly rewarding and intense experience so far. Incredibly exhausting, taking on the kind of trying to absorb the knowledge and capability of an entire organisation, but really, really wonderful to have connected with so many people from the community and had the opportunity to make decisions in the best interests of the extremely diverse and extremely active and engaged community that we represent.
Well, on behalf of the forum, I'm sure everyone present here, we wish you the very best in your endeavours, and we look forward to a strong partnership with both yourself and your council. And I've got to say that during the pandemic, it's been an absolute delight, an outstanding example of local government's interaction with community, the way local government has stepped into the COVID-19 space. I think Yarra's really done a fantastic job in terms of providing services to its most vulnerable community members. So we look forward to that relationship deepening. Thanks, Gabrielle. Well, now it's my pleasure to invite Lloyd Hanmer to speak on behalf of Victoria Police. So we were initially going to have Inspector Rebecca Marshall speak, Beck Marshall, but Beck unfortunately couldn't be with us today. So Lloyd has, Lloyd has stepped into the breach to talk about the overall vision and priorities for the policing in Fitzroy, Collingwood and Richmond, the whole of Yarra. So Lloyd, can I hand over to you?
Yeah, thanks, Peter. Yeah, look, I just want to first start. Yeah, look, Beck really wanted to be a part of this meeting today. Unfortunately, she had a conflicting schedule and was unable to come. So she is very keen to be on board and be at the next meeting. So she does send her apologies. So like Peter mentioned, my name's Lloyd Hanmer. I'm an acting senior sergeant at the Richmond Police Station currently. So I'm just going to talk about some of what we're doing in Victoria Police. I don't know how many of you are aware, but in January, as an organisation, we released our 5-year drug strategy. The drug strategy incorporates probably 4 key components. And so what we've done as a leadership group within Yarra is looked at those 4 key components and analysed what we're doing in relation to the organisational drug strategy. So what I'll do is I'll talk about each individual component and what we're, us as a leadership group in Yarra are doing around our organisational strategy. So the first area which our drug strategy tries to address is the prevention area. So that's in relation to the increase in demand. So that's trying to address a lot of the issues with regular users, trying to get them off the drugs, and so the demand isn't there for them, and people who haven't already engaged, so that early intervention model. So a lot of that work is done with our key stakeholders. So we're looking at engaging with probably people in this forum as well to address some of those preventative measures to stop the demand for drugs within Yarra. The second key component of the drug strategy is the disruption, and that's probably more what people think of us when it comes to the drug strategy. So that's the enforcement side of things. So as of this week, you probably see a lot more police out and about. Now, with the part of that drug strategy, we do acknowledge the health issues that come with drugs. So our focus in that enforcement side of things will be those that predominantly profit from crime. Obviously, we have a role to play with our drug users and different things, but there is a different focus in relation to that. Our primary focus in terms of the disruption activity will be along those, our drug dealers and the ones that predominantly profit from crime. The third component around our drug strategies is around the treatment. So that's predominantly for our strategies around looking at alternative prosecution options. So when I talk about the disruption activity with our people that profit from crime, we're looking at more of a health-focused approach with those that our local drug users and our people that deal drugs to supply their own demand, their own use. So we're looking at alternative options, so more diversions, looking at alternative options. I know some other areas looked at different resourcing models. I know we're engaged with the NJC at the moment and looking at our own strategies around that. And the fourth component that we look at is around the harm reduction. So that's in relation to our relationships with the Needle Exchange Program, the MSIO or North Richmond Community Health, and around the Adotey outreach workers about the effects of harm in the community. So we've got a bit of a four-pronged approach to the way we're looking at drugs in Yarra at the moment. It's still a work in progress for us. But that's sort of some of the things we're looking at and what our strategy will look like in the next 5 years and what we're trying to do to implement that strategy within Yarra. That's sort of where we're at. I don't know if you needed me to talk a little bit more, but or go into specifics about anything. But yeah, like I said, we're trying to incorporate a lot of different avenues in what we're doing with drugs in Yarra, and obviously have that health focus as much as a enforcement focus with our strategy going forward.
Lloyd, can I? How long have you worked in? You've worked in Yarra for a long time. That's
yes, I have. Yep.
Yeah, because we've crossed paths on occasions. In your time in Yarra, and this might be you don't have to answer this question if you don't want to. What's the biggest change that you've seen in policing as a police person in policing Yarra in your time in Yarra?
Yeah, so I think when I first started in Yarra was over 10 years ago, and it was all about enforcement. So I think what we used to do with policing in Yarra was, prosecute everyone, and that was our approach to drugs. And that is almost gone, a full 180, it's gone the other way. So we're very supportive of the initiatives that are in Yarra, especially around the supervised injecting room. We're very supportive of that. We have discretion around our policing in that area. We're trying to build our relationships with the AOD outreach workers to assist us when we attend jobs and not take it from a purely prosecution point of view, but from a purely health perspective and getting the people the treatment that they need. So there's definitely been a massive change in that regards. Yes, like I said, our focus will still be around the disruption of drugs and drugs coming into Yarra, but the focus will be on the ones that profit from crime. So your mid, to high level drug dealers, and for those that unfortunately have an issue with drugs and drug abuse, obviously we want to get that support and the referrals and assistance that they need. So, yeah, definitely in my 10 years in the area, I've seen a different change in focus there.
And Lloyd, there's a question for you on the chat, and the question's from Jan Black. Does the drug strategy that you talked about apply to alcohol as well?
The drug strategy itself is an overarching one for the organisation, and predominantly we've looked at it in terms of the illicit drugs within that North Richmond sort of housing estate area. So that's predominantly where we've looked at it. But obviously Victoria Police is involved and in the licensing forum, which Beck Marshall sits over. So we have separate strategies. And we actually have the overarching drug strategy, which applies to the alcohol strategy as well, but it'll probably be a separate focus as opposed to the strategy we're looking at and what we're doing within the North Richmond area.
Okay. Thanks, Lloyd. Thanks very much for your presentation today, and thanks for filling in at the last minute. Hopefully that'll earn you some rewards down the track with your boss. Anyway, so we might
thanks very much.
We might move on. So our next speaker is from Melissa Arduca, who's the Director of Workforce Policy and System Integration, mental health and AOD system policy, strategy and engagement from the Department of Health. Now, I reckon that's about the longest title I've ever seen for anybody's work title. So, Melissa, can I hand over to you? It's great to have you here today.
You can, thank you. I'm giving a reward to anyone that can shorten my title to something that is short and snappy but encompasses everything I do. But one of the things I do is I'm currently leading work at the department around the implementation of a new health-based model for public intoxication. I have a quick presentation and I'm going to try and share my screen. Let's see whether it works. Hopefully you can. So yes, as kind of has been said, the Victorian government has committed to the decriminalisation of public drunkenness, and indeed, if you've seen the news 2 weeks ago on Friday, that bill was officially passed in the Parliament, and on the 7th of November 2022, those offences will be officially repealed. The delay, that kind of 18-month or so delay, is to enable us the time that we need to work through the complexities of what a health-based response to public intoxication looks like. So I'm just going to quickly maybe run through this presentation just to give a bit of background for maybe those of you that aren't as familiar with it and where we're going as next steps. So you probably were aware the expert reference group was established by the Victorian government to provide them with advice on what a health-based response would look like to public intoxication. And one of the kind of the key things they looked at was what they thought the demand would be. And so when we look at the demand based on the number of people that were being arrested for public drunkenness, they found that over a 5-year period from 2014 to 2019, there were roughly 41,000 people arrested during that period, so an average of 159 per week. When we break that down a little bit further, we see 50% of those offences occurred within 8 LGAs. As you can probably imagine, Melbourne CBD is probably the big one there, accounting for over about 20% of offences. But other LGAs, and in particular the City of Yarra, is also one of the areas of high demand. And you see there with Yarra, there were roughly 1,500 arrests over that 5-year period, accounting for, 319 on average per year. But probably the most kind of critical thing when we're looking at this issue is the data really does point to some particular complexities for certain people being arrested at the moment for public drunkenness. So when we drill down into the data a little bit further, what we see is that most people arrested are what we're calling a low intensity cohort. So these are people that are only been in custody 1 or 2 times, and they really don't have any other kind of issues, or predominantly that kind of need support. So I've been very glibly talking about this group as they're your typical, young blokes down on King Street on a Friday night or a Saturday night, possibly had one too many, possibly being a little bit too rowdy. But we then see there's this high intensity cohort. So they're only about 6% of the offenders, but they represent about 26% of the arrests. And we see that this is typically a significant older cohort, so 40 plus, and also very high users of particularly homeless and ED services, and also kind of mental health services in there as well. So this is kind of a cohort that I'm sure many of you are quite familiar with, are already probably utilising your services. And, they're the ones that we kind of see this model as being particularly important to providing the support and care that they need. We also kind of see, when we look at the data, that there are certain cohorts that are particularly impacted by public drunkenness offences. Most of the offenders were young men. But of course, when we look at some of the demographic data, Aboriginal and Torres Strait Islander people were overrepresented, so being 6.5% of offences compared to being only 0.8% of the population. Similarly, the South Sudanese community also kind of stands out, representing about 4% of total offences. In addition to that, a strong intersect with people who are experiencing homelessness, but also kind of people experiencing family violence, both as perpetrators and victims of family violence. So there's a lot of kind of complexity in some of the people that, and the need to kind of make sure we've got kind of strong links and strong referral pathways into other services as we develop this kind of model. So the new kind of health model we're conceptualising really does reflect what the expert reference group recommended. And there's kind of 4 components that we're developing at this stage. So the first one is around having some further community outreach available. So that is having capacity available on the ground so that they can either be the first responders themselves or support other first responders to manage people that are found intoxicated in public, really with a focus on de-escalating situations, making assessment and transporting them to the place that they need to get to. The second element is, of course, that transport element, and that is looking at what are some of the alternative transport models that we may need to put in place, particularly in some of these areas where there is a higher level of demand that warrants it, to ensure that people found intoxicated in public can get to a place of safety. We also, of course, would see Ambulance Victoria would still also, of course, need to play a role in providing that transport as well. The third bit is around finding where are the safe places for people to rest and recover when they're found intoxicated in public. And our preference is, wherever possible, is to support people to go either to their own homes or to a family or to a friend's house where it is safe to do so. And where it is safe to do so is a really important caveat there, because we do know for some people, home is sometimes not a place of safety. So again, making sure we've got good triaging, good assessment processes in place to be able to understand where those places of safety are. If people do need somewhere else, an alternative to go to, we're looking up developing some options around some sobering centres or some sobering care places where if people need a short period of recovery, they can't go elsewhere and maybe they're not quite acute enough to go to an ED, that's where they will be able to get the care that's required. What's kind of critical as well across that kind of pathway that I spoke about, we're going to be working quite closely with Aboriginal community and either where there may be some specific services delivered for Aboriginal people or where services are delivered by mainstream, making sure that there is a strong element of cultural safety in that care. The final element of the kind of the pathway there is for that kind of complex cohort. I pointed out that we are using that kind of that temporary intervention point that can kind of be provided when people are either in the ED or in a sobering centre to support them to connect into other treatments or other supports that they may need. So, for example, can we connect them into alcohol and other drug services or help them to find temporary accommodation if they're homeless? So that's kind of at the very high level, the pathway that we're working very rapidly with our kind of existing kind of service providers to establish. I said there was a 24-month kind of phased transition provided. This is a very busy slide and I won't go through it in a lot of detail. But what I will kind of point out here is over the next 18 months, we've got basically kind of a 2 kind of phased approach happening. So we will be looking at establishing 3 to 4 trial sites, standing those up from 1 July 2021. And that is to really test the model that I just spoke about for us to understand what works and what doesn't. When I kind of say they're going to be trials, they are genuinely trials. We really don't understand what's going to be the best model on a statewide basis. And we particularly don't understand at this stage, what's going to work in the Melbourne CBD is going to be very different to what's going to work in Mallacoota. So there's a lot of work that we need to do to understand what is the statewide model going to look like. And the trial sites will help us to test different models of care and understand what are the services and what are the kinds of interventions that are working best for people. And as I said, as those kind of trial sites are operating, we will doing a concurrent piece of work around doing the mapping across all of Victoria to understand what we need to put in place to ensure we've got a statewide model that's available effectively, 24 hours a day, 7 days a week, 365 days a year. So when you kind of think about it in that context, it's a very complex piece of work that has to, identify, the millions of scenarios that could kind of play out as part of that. I'll just kind of talk quickly about the trial site locations. So the idea, as I said, with those trial sites is testing a differentiated service system. And we are looking at, in line with the ERG's recommendations, at least 3 trial locations, although we're looking at a 4th. So that will be 2 metropolitan areas of high demand. And so, as you would have seen on the other slide, Yarra is one of those areas of high demand. So it is one of the areas we are looking at as a trial site. And the second would be in a regional area of moderate demand. So probably one of those bigger regional centres. We're currently making an assessment of the trial site location and doing a final round of consultations on that, which will include local council. So I think we'll be knocking on your door shortly to talk to you about that. But we're really obviously keen to ensure that we find sites where we can kind of differentiate with the social and geographic settings, but also importantly where we know there's a lot of good kind of existing providers that can rapidly commence and scale a trial, because as you can imagine, setting this up in 3 to 4 months is very short, and so we need the kind of the capable partners in place. And just finally, the idea is we'll test different models of care in different areas, and really using that, working with the local providers to look at what might be the best model that reflects the needs within a particular area. I think that's it. Sorry, I know that was a very rapid kind of run through, because I know you're all very kind of short on time today, but happy to take any questions that people may have.
So, Melissa, we've got a question in the chat room. It's from Kevin Myers from St Vincent's Dual Diagnosis Nexus. Hi, Melissa. In terms of the model, he's wondering how the community outreach component should engage around mental health, as this is often a co-occurring issue.
Yep, you're absolutely right, Kevin. And one of the things that we are considering as part of the establishment of these new outreach teams is that, that they do have capability not just to respond to instances of public intoxication, but, they possibly do have that dual diagnosis capability and could do, both AOD or mental health, or indeed maybe some of the other issues that, again, this kind of complex kind of cohort needs. Kind of one of the, it kind of helps us to kind of resolve one of the issues that we will have, which is, we don't want people sitting around doing nothing. We're really, that might be nice for some people, but, kind of recognising that, we need to create some scale in these kind of outreach teams in order to get the investment that we need from government. But we think there's some really nice synergies between, having a highly skilled outreach kind of approach that can deal with a multitude of kind of supports that people require.
There's also a question, Melissa, from Hing Lim from the NJC. Will consultation be with direct community members about what works in terms of, say, cultural appropriateness or other issues?
It is our intention that as we develop the statewide model, that we will use a kind of co-design approach, and we will and part of that is working with local communities around what is required for cultural appropriateness for your particular area. So again, for example, areas like Dandenong, who do have a large kind of South Sudanese community, they will need both, cultural safety in terms of the Aboriginal population there, but also kind of supports, culturally appropriate supports for some of the other diverse communities that reside in that kind of area as well. So the intention is we will work with community on that. We're a little bit limited in how much direct work we can do for the trial sites, and that, I say that as it's a bit unfortunate, but that's just a bit of a time pressure. But our intention with the trial sites is to utilise existing providers, and we're hoping to kind of tap into hopefully the existing networks and partnerships they have with community members to ensure that kind of cultural appropriateness and cultural safety is in place.
Just to comment on that, or a question on that, Melissa, one of the things that it strikes me in very complex and culturally diverse communities, it will present a really big challenge to actually hear the voices of such diverse community members in terms of the models that will be appropriate, because it won't be one size will fit all for those responses, will it?
Yep, you're absolutely right.
Yeah,
yep.
So
and I don't have an answer. If anyone has the answer, please let me know. It's incredibly complex, and how that's going to work it's why we really want to take quite a strong local focus as we develop the statewide model, because as I said, Melbourne CBD is going to, in and of itself, is very different to the City of Yarra, different to Dandenong, different to Ballarat, et cetera, et cetera. Yeah.
I'd also like to acknowledge the great work that Yarra Council has done in actually, they've got a working group that has been meeting probably now for, I'm guessing probably half a dozen, maybe 8 meetings around the issue of public drinking and alternatives to a law and order approach to dealing with that coincides with this process. And a shout out to the staff at the City of Yarra, and also to Uncle Colin Hunter, who works for both the Wurundjeri Council but also for the City of Yarra, and the work that's been done in that space in partnership with some of your folk, and also people from Turning Point that are doing some research and in-person interviewing with street-based drinkers. So there's some good work being done. There's a question here from Chris Stew from AXO. Hi, Melissa. Are AOD treatment providers already on board, i.e. established referral pathways for the trials?
We haven't spoken to every single AOD treatment provider, but we have been speaking to some of our key providers as part of this work, yes.
Yep. And from Rod Wilson from North Richmond, the commissioning of AOD and mental health seems very siloed. Any changes to that? Is that a Dorothy Dixer though?
I don't think so. That's a bit of a rough one. I'd actually kind of, I'll go off on a bit of a tangent and say, for those of you that love the boringness of what happens in the bureaucracy, the establishment of the new Department of Health from the 1st of November also saw the standing up of a separate mental health division, and the AOD portfolio has been incorporated into the mental health. And that was a very deliberate decision that was made in recognition of the strong degree of co-occurrence between people who have mental health and AOD issues, and the need for the two sectors, although it's kind of, the wording I'm using is separate but together, about, obviously they still do need to kind of have their own kind of separate processes, but taking a much more integrated approach into how we're delivering care for clients in the treatment system. And I'd also just kind of say, of course, the Royal Commission report will be coming out tomorrow. Part of their terms of reference was to look at people with co-occurring needs. And so, we're certainly anticipating it will also have something to say quite strongly about the kind of the interface between the AOD and the mental health system.
And Hing, I think you've got your hand up.
I was just going to say what you said about the working group, that Melissa, you could probably link it straight in terms of direct connection with community. So, good community voice being represented there through the working group.
Okay, thanks, Ian. No, thanks for that. I think that's just about all we've got for you, Melissa. But really appreciate your input today, Melissa. And I know that across Yarra, this is a really keenly followed approach that has been taken by the department. And I think the government, but the department needs to be applauded for the step that they've taken and actually taking on this issue, because it's long overdue. And I think, we really look forward to working with the department and the city around this issue to get a really good outcome for people who are very, very vulnerable in terms of issues of public drunkenness and public intoxication, because I think the other thing that needs to be raised, it's not just going to be about alcohol, it's going to be about public drug use as well.
Yep. So I very deliberately use the terminology in public intoxication, because we do know, you very, very often can't just come up to someone and say, you can't tell what substance they've been using, and we're certainly not going around giving everyone breathalyzer tests. So it will be a response to people who need help in public, irrespective of what their, what the kind of the cause of that is. Yeah. So
thanks very much for your presentation, Melissa.
No, thank you.
Good on you.
Bye.
So now we go from the broad to to a very specific approach, an issue around the impact of amenity and social issues and improving well-being, and that's to we welcome Mr. Ian Adotey, who's the manager at North Richmond Community Capacity Building Initiative. Ian's going to do a presentation and an update on Engage Richmond, which is Department of Families and Fairness and Housing. And Ian's going to talk about the process so far and what's going to follow. I'd just also like to acknowledge what an amazing contribution Ian has made, not just as a public servant, but as a human being to the area. And we're very lucky to have people of Ian's calibre working in and with the City of Yarra, and more specifically North Richmond. So it's over to you, Ian.
Thanks, Peter. I never know when to take you, as you try to have a little joke with me. I know you admire my services for promotion of baseball caps.
I've got to say, Ian is the best dressed man on Zoom that I have seen.
Thank you very much. Thanks a lot, Peter. Hi, everybody. Look, I'd like to acknowledge I'm also here on Wurundjeri Woiwurrung land. I'd like to pay my respects to them, their elders past, present and emerging, and other Aboriginal and Torres Strait Islander elders and communities across the country. Look, I'm hoping that people are aware of what I'm talking about to speak about, and I also want to acknowledge I've put a flyer in the chat, and I want to apologise to Melissa. I was trying to line it up, and Zoom defeated me by sending it prematurely. But I'm going to talk to the North Richmond community grants process, and as I think Gabrielle mentioned, this is all intertwined with the Hamilton report. And the recommendations that came out there. We'd all be very well aware, I think, in this room of the great things that the great data around the injecting room in terms of its sort of health intervention, but there was clearly a commentary around that. I suppose the additional work needed around amenity and neighbourhood and partnering with community, and I guess, look, as a public servant. There was a really lovely opportunity that arose when that was announced by the Premier back in, I'm going to say, May or June last year, and that was around a pretty significant $9 million allocation, very much targeted at the North Richmond precinct. And then within that, there are a number of subsections, but very excitingly was a ring fence of projects that the community choose or projects that the community select. And we, I guess, in sort of former Department of Health and Human Services, were in charge with trying to think about what that might look like. And that's what's led us into this process. And I will kind of attempt to share my screen, only because there's we have a website which I think kind of articulates where we are. So let's see how we go. And if I can get a couple of thumbs up, if people can start to see what's on the screen there, that's wonderful. Thanks, Gabrielle. Okay, so this is, we've basically put together, a very targeted suburb-based community grants project. And as I say, these, for me as a public service servant, these opportunities don't come along every day. This is a real, there's a real sort of like an opportunity, I think, for the precinct, and to try to kind of really arrive at some community-driven responses or actions which can really improve the community, improve the amenity. And there were two bits to that. We solicited project ideas, and there's a little timeline just down here on the right-hand side of the screen, which I'll just scroll up to. And you can clearly go and check this out in your own time. I hope that maybe some of you have already done this. But we asked people to put up projects or initiatives that they thought would really make a difference to the amenity and I guess opportunity which is there for community. We opened those project applications in mid-November, and they ran till the 20th of December. The approach was that community members were asked to link with organisations to act as auspices. Organisations in their own right weren't really the target. It was more to kind of try to stimulate that as a bit of an opportunity for community. The department received those applications just before Christmas, and then did some internal work to match them against the guidelines. And then the second phase was that we've now got a handful. I think it was 21 projects which met which aligned with the guidelines. Gone now into a process really of engaging with the community to get some, we hope, really clear advice on which of those particular projects which do have energy and which do have support from community. And our intent is to fund those which the community tells us they feel can have the most impact. In doing that, I'll scroll a little further down. We opened the community engagement round, as you can see from the timeline there, and we're in that with the staff from the 11th of February. I think the circuit breaker response to COVID kicked in the day after that. We were initially looking to close applications around about the 26th or 27th of February. We've extended that out now till the 7th of March. Largely the reason for that was, whilst we've clearly invested a little bit of time, and I'll just scroll back up, in trying to direct people to our website, which we've taken the time to actually kind of to translate into the three key languages. The key languages are in North Richmond in the estate community anyhow, is that we've probably got about 25% of people who would prefer to get their communications in Vietnamese, and then we've got a significant number of people who access simplified Chinese in written form, so whether that's because they're Timorese or from China, from various parts of China. And then the feedback that we've got is that if we also provide materials in Arabic, then we actually pick up on a significant portion of other residents, particularly from the Horn of Africa. So we've mail dropped the estate. We've also mail dropped essentially all of North Richmond. We've had some great partnership with City of Yarra with their business services, doing some outreach and flyers to shops. And we're very clear that whilst we want people to try to come to this site to vote, we also know that some people will not be able to do that, either because they don't have access to the internet, or they do, but they're not necessarily that confident or sure where to go. You do need an email address to cast your kind of preference, and that's been a barrier for some people. So we have and it's detailed on the flyer that I put in the chat. We have a number of opportunities for people to come face-to-face where we have translated materials, and we also have people who can assist. Sometimes some of the, some groups, particularly some of the some more elderly members of our community who've, needed a little bit more support in being able to understand the process and work out how they can kind of go through that and have their say. As I scroll down, just essentially the way we're working, anybody who lives, works or visits North Richmond is welcome to cast a preference. You need to vote for 3 projects. There are 21 projects up, and I'm not going to flag any in particular, but I'll just sort of scroll down and you can have a bit of a look. Feel free to visit the site yourself. But your pool of 10 votes you can spread them across any of these projects. Obviously, I think my problem is I thought the first 10 looked great and voted for those, and then found that I had to sort of take some back and try and work out which to be a little bit more selective with my choices. You'll make your own choices. You and others are welcome to have your say on which of these projects. And I'll take an example here. Let's go with this one. If we go in, then we do get an actual little bit of a description of what the project is. And this is probably quite a good one here. This was one which was focused on exhibiting photograph works made by the people who access the medically supervised injecting room. So that might be something that you might wish to look at. Each of the projects has a description along that, and it outlines which is the organisation which is supporting that. I've chosen not to put up the community members' names specifically. I suppose what I would say then, in terms of timeline, we'll close this. Let's see if I can close this. So people can vote. Closes next Sunday, which is the 7th of March. And then the department will have the results from both the web and also the in-person voting. And we then will go through a recommendation process and announce which of these projects have been supported and funded. We're hoping by the end of March. The quantum for this funding we were inviting projects which were between $5,000 and $200,000. It's pretty significant, I think, for a local RAM, which is sort of suburb based, and so a great opportunity for North Richmond. There's still then, I think, the opportunity of thinking is that in line with the Premier's announcement that there's still a similar 1.5 million quantum of funding still left. I think, as I say, this was something that we've come into, and I've definitely taken some learnings of this to date. We're working, and our approach is to use the community engagement groups that we've established in the precinct, the precinct committee and the reference groups, and to go back to them, and that's some of you in this room, and sort of say, hey, there will definitely have been bits of this that we didn't quite nail. If we have an opportunity to do this again, what are how do we do that? And that's everything from, the generation of the ideas to the type of guidance that we give to people in terms of building their ideas, to the way that we've kind of set up the website, through the voting and the support that we give to people who can't do that via the web. So I think there's going to be a whole heap of learnings, and I'm hopeful that we'll get we'll get a really strong set of projects that are genuinely proposed by community and that have been selected and kind of recommended by the local community. And that also will have some learnings which will help us to, as we hopefully go into another round later, at some point later in this year, help us to do that again, and to do it in a better way, so that we really kind of maximise the outcomes. I'm happy to take any questions. Look, thank you in advance, and enjoy casting your votes, and please promote to everybody that you know.
Isn't the phrase vote early and vote often?
I don't know about vote often, Peter. Vote early is good.
I've got a question to kick off, Ian. What is there any? I don't want to use the word evaluation, but how are we going to assess the impact of these projects on community?
Yeah, I think that's a good question. I think the projects are really quite diverse. We've asked each of them in the process to kind of to articulate what their outcomes would be. We have some broad sort of like data related to the estate, which is sort of like outcomes related data. The trick is it always becomes a bit difficult sometimes to make the direct kind of linear links between any particular intervention. And I think particularly in a place like North Richmond where there's so much going on, to make kind of like direct links around whether that be safety, whether it be sort of health, is a tricky bow. But I think trying to keep people honest to the outcomes of where their funding was intended is probably where we're at really.
Any other questions folks have for Ian about the project? Completion dates. How long? You probably said this before. How long will they be funded for? Life of the projects?
They all have to. I think it was for them to try to complete by the end of this year. But I think there'll be leeway on that. There's been so much kind of a breakage in terms of sort of like the flows with different COVID restrictions. I think what we want to do really is to get things up and moving and and hoping that people can actually still deliver in the way that they would wish. I think it's a brave person who has a crystal ball at the moment to say, hey, this is how we're going to be able to proceed. But yeah, look, we've got the opportunities is for now. And as I said, I think, we're at the moment, as things stand, we would look to do another round later this year. I don't have a precise date on that.
Okay, we've got a question from Rod Wilson from North Richmond. Any idea of what will happen to the balance of the remaining funding of the 9 million?
Yeah, sure. Look, the 9 million, and we've kind of tried to explain this via the community committees. There are a number of other kind of streams within that. So I'll give you a few examples. There's currently a project, if I'm going to hard numbers, but it's a significant project of a lighting upgrade to the estate, which is in progress at the moment. There is some money which has been ring-fenced to upgrade some of the community rooms on the estate. And there is a broader, more flexible pool around landscaping and greening, which we don't have a great deal of kind of vision as to quite how that goes, but that's the sort of the level of detail I've got at present on landscaping and greening in and around the precinct. And I think the detail on how that's going to play out is still being worked up. So if I was to go through, if you think, Rod, in terms of that, there's this 3 million for the community-driven grants. There's about a 3 million chunk roughly for the landscape and greening. And then there's around about 3 million, which is already kind of committed to some of the various sort of like largely infrastructure-based responses in and around the estate. That's just at a high level. That's what we've got.
And this is from Tim O'Leary from North Richmond. And do you have any information on how the latest housing initiatives will impact on North Richmond housing estates' open areas?
Look, I suppose the one that if in terms of open areas, if I'm walking across the estate, the one that springs to mind, which is sort of fairly new, is the Big Build announcement for the social and affordable housing. I don't have a great deal of information on that. I don't know the precise number of units. I know it's a significant investment, sort of in excess of $50 million. And that's, for those who are familiar with the estate, there's a significant open green area on the north side of Elizabeth Street that the Premier and the housing have earmarked for social and affordable housing. I'm not able to kind of pick apart exactly what the sort of sub-levels of social and affordable housing that is and how or how that might split between public and or social housing. I don't have that level of detail. I do know that I think particularly over the last 8 to 9 months, the department's been, I think, very conscious that it needs to kind of get out and be proactive in its communications with community on any piece of work that it does. I've found that refreshing. It's obviously sort of like, I think, driven by the learnings that we have from the lockdown last year in North Melbourne and Flemington. So I guess we'll be trying to be on the front foot and letting people know what we're planning to do in the context of that sort of social and affordable housing work.
There's also a question from a community member, from David, and he's wondering how you get involved in some of the arts projects that are there. So if people are starting these projects and get funded, say, in an arts area, how does a community member get involved in that project? What would be the best way to do that?
Yeah, look, that's a good question, David. Look, I think probably keeping an eye on which of the projects which are funded, and then you can come to myself, to my team, and we'd be happy to link people. I think the vast majority of those projects are quite, keen to work themselves with community, so we can kind of link you. Some of them are entities that it's very kind of clear how you can link with, such as the school, for instance. Others are obviously, I'll put one up on the screen there. That's probably a little bit more kind of targeted to users of a particular service. So it probably varies, but I'm happy to be contacted. You can email me and we can discuss what you might be looking for.
You might want to pop your email in the chat room.
Yeah, sure.
That'd be great. And one other question. This is more of a comment from Rod Wilson. It's important that the funding doesn't get used for what should be the Ministry of Housing's responsibility anyway, i.e. lighting. So I think that the issue is the money should be used for the projects that are above normal maintenance and maintaining of the physical facilities. Yeah? Take that as a comment, Ian?
I'll take that as a comment. Thanks, Rod.
Above your pay rate, buddy. Okay. And look. I just want to. I don't think there's any other questions. I can't see any. I'm not the world's best Zoom facilitator. You've probably all worked that out by now. But I think that's just about all of them. Look. I think we're all wishing the department and the community the very best. We want change in a positive way. Everyone does in Yarra. And I think that goes from people that have been watching this for a long time to people that have just, come across this as an issue. And I think there's a real spirit of goodwill and community that's surrounding all these things. And let's hope that if there's anything anyone in this chat can help you with, we all put our shoulders to the wheel for a great outcome for the community. So all power to you and your cause there, Ian. And thanks for coming on today and sharing with us.
Not at all. Thanks, Peter, and thanks everybody for the continued partnership. Really appreciated.
No, it's great to have you, buddy. Great to have you. So it leads me to not the last or least, but to Bernadette. Bernadette, we invite you to give us a bit of an update on the Yarra Drug and Health Forum. Over to you, Bernadette.
Thanks, Peter. I probably feel I've got to speak truth to power a little bit here in relation to the money going into North Richmond, just the context of where the outreach, NSP outreach has got as I understand it, only a funding commitment till the end of June, and is such an instrumental part of the issue of neighbourhood amenity associated with injecting drug use that I just, I'm not sure who to go to with that observation, but it is an observation to make. I know the police certainly value that the outreach NSP workers in relation to being able to work with the community of people who do use drugs in Yarra. So, yeah, anyway, so I've just had to say my little say. Now, we've got a strategic plan at Yarra Drug and Health Forum, and it's got two main, and most of you will have already seen it. I don't know if I can actually share my screen because I haven't got the document there, but there were two main areas that we were going to be proactive about initiating or leading, and we'd got to these areas through a process of the executive committee looking at a number of issues that people are working on that are AOD related in Yarra, and making decisions about what Yarra Drug and Health Forum was uniquely positioned to, or best positioned to lead and support. And those two issues were addressing stigma and discrimination for people who use drugs, working with the community to do that, working with the local community, and the other one was working with the local community to try and enhance or involve the voices of people with lived experience of drug use. So those are the two areas that, in addition to just responding to issues as they arise, such as the local Law 8 or the public drunkenness issue, these are the areas that we're proactively driving some activity around. So in relation to stigma and discrimination, we've had a number of sessions with different interested people, and I'm still very willing to hear from people who want to be involved in that work. But one of the things that we've done is form a harm reduction communications alliance amongst a number of organisations so that we can get some positive news stories out into the media, boost each other's media releases, and get some humanising and sympathetic or non-discriminatory, non-stigmatising press or influence with the community. That's one of the main things that we've done, and you might have recently seen a press release that we put out with a number of organisations around supporting International Family Drug Support Day on the 24th of February, and we've always been involved in and had very good community engagement and response to the International Overdose Awareness Day. That's on the 31st of August each year. So we're looking at different ways of contributing to the work other people are doing around addressing stigma and discrimination, and got really just some formative thoughts at the moment about how that might go. But a couple of the ideas that are up there that are under development are to maybe have a pledge in City of Yarra, all services in City of Yarra that will use non-stigmatising language in our services, and quality assure that that's what we're doing, so that people using any service in the City of Yarra don't experience or don't feel they experience stigma. Another one is there are people like Sane Australia runs a Stigma Watch initiative, looking at how we can link into that and maybe localise activity in that to the City of Yarra. And another idea that's in consideration is to actually have a specific anti-discrimination day in Yarra, a City of Yarra day to reject stigmatisation and celebrate inclusiveness with the diversity of the Yarra community. So that's a kind of very, early days, kind of like what the activities are shaping up to under those things. And they're really in addition to or to boost, the opportunities that exist in our monthly community forums and involvement on other forums, representing, if you like, the issue of health-based approach to drugs in other forums. So, so that was my very inarticulate way of updating you about what we're doing. And I'm getting a couple of messages here about people who'd like to be involved, and if there's some things that people think are really that they've seen or that they want to contribute to in this way, that would be fantastic. Let me know. And particularly around the voices of people with lived experience. That's one that's actually a really difficult one to get movement on. Okay, that's it, I think, for me, Peter. Maybe there's some people here today, Peter, though, that would like to just introduce themselves. They're relatively new. Like I can see Anissa Jaros, who's the new inner space manager, is here. She might like to just, I don't want to put you on the spot, Anissa, but you're relatively new. And I think Chris Drew is new to our executive committee, but he's left the meeting, I think. So, won't have that opportunity for him.
Yeah, so if there's anyone that would like to jump on, and also if there's any news that anyone would like to share or anything that they would like to offer, before we go to that, I'd just like to say that I'd like to congratulate Family Drug Support for the event that they put on at the Hawthorn Town Hall on Friday. And I attended that, and Chloe Martin as the worker, but the organisation generally, acknowledging and really highlighting the impact on families that drugs have, and how often those families are not heard and not spoken about nor considered. And the people that spoke, some crossbenchers spoke at that forum, but the highlight of the morning was really the lived experience of family members who spoke about their experiences. And I just want to make sure that's acknowledged. But anyway, so over to anyone who would like to jump on board and say anything.
Anissa, are you there? Would you like to introduce yourself?
You're not going to let me get out of it, are you, Bernadette?
No.
Hello.
Just a quick hello.
I am the new program facilitator for Inner Space. I know Leanna Hillquest is here too, who is my line manager. Great to be on board. I have a nursing background but new to AID. Eager to learn. Please don't hesitate to give me a call or pop in and say hello. If you're ever around Inner Space, we're looking at doing whatever we can to support you all and the community. Thank you.
You're very welcome. Is there anything anyone else would like to do? Introduce themselves or say good day or promote anything that they've got?
Peter Rod Wilson here. I'm a relatively recent chair of North Richmond Community Health. I really had a question more for the council around, Gabrielle, great to have you on board as a new mayor, but just the progress around the youth development on North Richmond Housing Estate, how it's going with the new facility. And I understand you're planning to put a youth worker on the housing estate. Is that, do you have an update on any of that?
Thank you for that question, Rod. I think I'll have to defer to Lucas if he's around on that. I know there are discussions around that, but I'm not probably not the best person.
I can speak to that, Gabrielle, if you wish. I don't know if Lucas was on earlier. Yeah, thanks, Rod. Look, I know that the coordinator started on the 4th of February. That person's name is Sandra Tay. Some of you would know Sandra. She's been a youth worker with Drummond Street Services, who are contracted to deliver youth services by City of Yarra at Collingwood and at Richmond. So look, from my perspective, that's a real win, because she has some standing relationships, both with the young people themselves, but also with a number of the kind of agencies that work with young people. In terms of the programming, the kind of backdrop at the estate has been that the community rooms have been closed, sort of like due to COVID. However, that particular one, we've agreed a COVID sort of safe plan as things stand with the City of Yarra. My understanding is they're hoping to get some programming going as soon as next week. There are a number of activities with young people that use that local precinct. So I think as a start point, they're going to try to tie in with that. But I do know that one of the things that Sandra was quite keen to do was to be reaching out and working out what are the other things that young people would really see as really bringing that place to life. In terms of, I suppose, the what that means in terms of like the sort of presence there, our view, and this is in the funding that we provided to City of Yarra for the coordination, the view would be that there would be a youth worker on site from 3 till 7, Monday to Friday, and then potentially other activities at other times outside of that, whether that's during school times, that might be appropriate, or whether that's at weekends. So that's kind of where things sit at the moment. So it's pretty exciting.
Yeah, terrific. A great start. Hopefully we can build on that. That'd be good. Yeah.
Any other comments? Any other questions, folks, for any of our panellists, or for any broad statements anyone would like to make? I'd just like to say that probably I don't want to drag this out, but drawing the forum door close is that the Yarra Drug and Health Forum is only here because of the partnerships that we have and the engagement that we have with the community, and we encourage that partnership and we encourage that engagement. So if anyone's interested in becoming more involved, please feel free to contact Bernadette. And we have an executive. We are welcoming people to join the executive at any time. That is always open. And we're also welcoming any ideas about how we might improve or tackle topics that people would like us to tackle. And we look forward to serving the community of Yarra and not directing the community of Yarra. So we look forward to partnering with all those present and reaching out to those who aren't. So we look forward to a year where we can actually be in the same room occasionally together too. But I think what we're going to do now, I think we might close now, if that's okay, Bernadette. So on behalf of everybody here, we want to thank you for your attendance. We want to thank you especially for the presenters. And Gabrielle, we really appreciate your time as Mayor. It's a busy time for you in coming today and speaking with us, and we look forward to working with you and your council. And we look forward to working with everyone that's in the room today. So thank you very much. Stay safe and have a great day. Cheers, everybody. Farewell.
Thank you for your wonderful